Hi, Gina. How are you?
I'm great, Mr. Vice President. How are you?
I'm doing great. Thank you so much for joining us, and I want to get right into this. You did, in my opinion, an absolutely terrific job as head of the EPA and former President Obama's second term, and you have always said that the EPA is primarily focused on public health, or should be, and you have always stressed the connection between the climate crisis and health. Tell us why.
Well, I just think it's really important that people understand that climate change is the biggest threat to public health that we face today, or frankly, any generation has ever faced. And it's important because health matters.
Yeah.
People care about the health of their families. They care about the health of their communities. We need people to focus less on being afraid and more about motivating the actions that are going to keep their kids safe and hand the next generation a future that we're going to be proud of. Health motivates. I've been doing this work for a long time, and it's really not about the health of the planet. It's really about us. It's not polar bears, it's our kids.
Yeah.
And if we can put a face on climate, make it personal, then I think we can broaden the actions out there, and we need it desperately right now.
Yeah, I definitely agree with you. And it's not only true here in the United States, but in all of the countries we're going to be visiting during these 24 hours. In fact, earlier this year, the World Health Organization put out a comprehensive report on the health impacts globally of the climate crisis. I know you're very familiar with that, but they talked about air pollution, safe drinking water, food insecurity. Which of these, I don't want to ask you to pick which is the worst, but they all add up to a global health crisis.
They do, and I think a lot of what you're raising today, already starting today in your introduction, is the full range of health consequences and threats that climate change poses. But the really interesting thing is that if we do put this face on climate, and it's beginning to come now, I know we've been talking about these things for decades, but even in the U.S., we see 3 out of 4 people actually understand that climate change is happening, and it's happening to them. It's happening in the United States. It matters to them, and we can motivate change. And my goal would be, if you look at climate through a health lens, you can make people healthier today while you set us on a road towards a more sustainable, cleaner, healthier, and more just future. So why aren't we thinking about how we run to that future? How do we demand that our politicians respond appropriately, our leaders think about what's important to us today, and not try to deny the science or run away from it? We need to run towards a low-carbon future because it's better for everyone.
Yeah, definitely. And by the way, since you left as EPA director, you've now started this organization called Sea Change, based at Harvard. Tell us what you're doing there.
Well, you know, when I left the administration, I took and did a couple of fellowships at Harvard, and I got so enamored with the students because I've never seen such really smart thinkers who understand that we're dealing with systemic challenges here and who really focus on social justice. And I think that's a fundamental thing that you're focusing on here today. And I think we all have to focus on it because carbon pollution is not an equal opportunity killer. It does go after the most vulnerable, our young people and our elderly. So we started to talk about how the Environmental Protection Agency wasn't really an environmental agency, it was a public health agency. It was about eliminating premature deaths from exposure to pollution. It was about looking at climate change as a pollution challenge and how do we make change. So Sea Change that I now run at Harvard is a center that's looking at translating science that we know about the health impacts of climate, about looking at how we motivate actions in cities and towns at the grassroots level up, because in the United States, we don't have to simply wait around for the federal government to act. We can actually motivate actions from the grassroots up, and that's generally how we actually innovate. That's how we change.
Yeah.
So I'm hoping that real science matters. I'm hoping that science about health can really motivate change and action. And I think we can lead, the United States can lead even when the federal government doesn't want to. And that's my goal, is let's motivate people grassroots up. Let's talk about our kids. Let's talk about health. Let's run towards a better future together.
Yeah, and you mentioned social justice that many of your students are raising, and social justice includes environmental justice, and these health impacts from the climate crisis are disproportionately affecting poor communities, minority communities, disadvantaged communities, and that's a big part of the problem, correct?
Yeah, it really is, because if you look at it across the world today, pollution is estimated to cause about 9.5 million lives lost every single year.
Wow.
And about 7 of those are air pollution. And as we know, air pollution can be exacerbated by a changing climate. But what you see most dramatically is that 93% of those deaths are in low and middle income countries. So we have to understand that this is a social justice issue. This is robbing the most vulnerable of their future. But on the flip side is that if you start thinking about directing climate actions in a way that's actually focused on those communities, in a way that looks at reducing air pollution in those communities first, you can start balancing the scales. You can actually go where the health benefits are the most, and you can actually make the most of climate investments by looking at where the health is most needed to be improved and how you direct those actions to those particular communities. And so I think we can turn this on its head and really turn what is essentially the biggest threat of our time into the one that can tackle the leftover pollution that is killing so many people. And if we don't get a handle on it, we'll kill millions more. And by the way, cost the United States and other countries billions of dollars in lost health care, as well as economic damages by reducing the assets we have in this country.
Now, just 10 days ago, on Black Friday, immediately after Thanksgiving, the current administration allowed the release of this 4th national climate assessment here in the U.S. I know you paid particular attention to that. How would you interpret for our audience the health impacts that were described in that quadrennial climate assessment?
Well, there were 3 really big assessments that came out recently, and it's pretty exciting because each and every one of them focused on health. You had the IPCC report, which you're all familiar with, which is the large science report, and it showed us that climate change is real. It's actually happening faster than we thought, so we really do have to get moving. And it really, once again, told us that fossil fuel burning is really the big issue here that we have to tackle. Then we had the National Climate Assessment in the U.S. And the fun part about that assessment, if any of this is fun, but the engaging part is that it looked at every region of the country, at where we are today, what we're seeing in terms of health impacts, and what we're seeing over the years that we can anticipate happening based on all of the data we have available. And it looked at 2050, 2100. And what was exciting about that is it really did look at the full range of health impacts that we're seeing today, the full range of health impacts that we expect to be seeing in 2050 and 2100. And it talked about each and every region in terms of what those challenges are. So it talked about the vector-borne diseases and how they're spreading more than ever before. It teed up the issues about mental health. And we had a report that came out of Lancet, which is called the Lancet Countdown, which really was all about health, described by physicians, researchers, people that we trust. And it talked about what we're seeing with those health consequences and why it's so important to take action today. So the tea leaves are lining up. We're moving away from being afraid to really grasping that we have to take action on this issue, but also looking at how to do it in the smartest way, the way that actually helps to benefit all communities today, especially those that have been left behind.
I love the way you communicate so clearly about this. I love and appreciate the job you did at EPA, and everybody wishes you the best of luck and success with Sea Change, your new organization, and your special focus on climate and health. And thank you so much for being a part of 24 Hours of Reality. GINA MCCARTHY, thank you.